Hello, and welcome to this discussion about the NCLEX RN examination test plan. The learning objectives for this discussion are: identify the 8 areas of the NCLEX RN test plan, and identify how the 8 categories guide your preparation to take the NCLEX RN examination. The NCLEX RN examination is like all standardized tests. It has a test plan. And this test plan defines the nursing actions and the competencies that are tested on the exam. On the NCLEX RN exam, they utilize a conceptual model called Meeting the Client Needs Model. And this Meeting the Client Needs Model tests about clients in all settings. Now, one of the things I want you to think about as we start looking at the Meeting the Client Needs Model is when you think about nursing school, all of your content was organized in some way. Now, some of you all went through a specialty model or they use systems. So, for example, regardless of what type of program you had in nursing school, your nursing program was obligated to teach you about medical surgical nursing, psychiatric nursing, and OB nursing. And they organized the content in different ways. Some who did the specialty system, you took med-surg courses, and your med-surg courses were probably divided according to the system. You took an OB course, you took a PEDS course, you took a psych course. Now, some of you all were in an integrated curriculum, and in an integrated curriculum, they take the psych, PEDS, OB, and med-surg, and they teach this in a course in each semester. And the material might have been organized based on wellness to illness. Maybe it was based on a theoretical nursing process, but it was organized in an integrated way. Well, that's exactly the way National Council does it, but their integrated test plan is Meeting the Client Needs Model. So it's not based on the medical model, it's not based on systems. Everything is integrated. Now, NCSBN.org has a lot of information about the test plan. So first of all, you can go to their website and you can download the test plan that we're going to talk about in this discussion. You can also download the practice analysis and the knowledge survey. Now, one of the questions that students ask is, where does this test plan come from? And because you've just graduated from nursing school, your assumption may be that it comes from nursing school, that they look at what you all are taught in nursing school and then they put the test plan together. But that's not the way it works at all. The Meeting the Client Needs Model, the NCLEX exam, actually faces nursing practice. So every 3 years, they do what is called a practice analysis, where they send out around 140 activity statements to nurses who graduated in the last year and are practicing nursing. And these statements include statements such as assist client to compensate for a physical or sensory impairment, perform skin assessment and implement measures to maintain skin integrity, assess and manage clients with an alteration and elimination. So if you're one of the nurses that have received the survey, what you're going to do is look at each one of these statements and you're going to rank it on a 5-point scale about how important is it and how frequently do you do that. So then they analyze the practice analysis, and this is how they come up with the test plan. Now, item writers have to write the questions that are on your NCLEX exam, and they use what is called a knowledge survey. So what National Council does is they have about 230 knowledge statements. They send these out to a different group of nurses who graduated within the last year and are practicing nursing, send it out to nursing faculty, subject matter experts, and also to nursing supervisors. And they have to go through and rank the importance of these statements. So actually, you can download both the practice analysis and the knowledge survey, and it will give you a lot of information about how NCLEX organizes its material. For example, I told you there was an activity statement: perform assessment and implement measures to maintain skin integrity. Well, the knowledge questions underneath that are client assessment, client safety, client skin assessment, nutritional assessment, documentation. So this guides you in the way you need to be thinking and preparing for this exam. Now let's look at meeting the client needs model in more detail. It has 4 categories, and 2 of the categories have subcategories. The first category is safe and effective care environment. The subcategories underneath it are management of care and safety and infection control. Health promotion maintenance is another category. Psychosocial integrity is the third category. And the fourth category is physiological integrity. And it is divided into 4 subcategories: basic care and comfort, pharmacological and parenteral therapies, reduction of risk potential, and physiological adaptation. So let's look at each of these subcategories in more detail. Management of care is 20% of the questions that you receive on the NCLEX exam. It doesn't matter how many questions you have, 20% of your questions will come from management of care. Now, some of the topics that are included in management and care include advanced directives, case management, concepts of management, delegation, and establishing priorities. So all of the who do you see first questions, or which action is most appropriate for the nurse to take, would all be considered management of care questions. The second subcategory under safe and effective care environment is safety and infection control. 12% of your questions come from safety and infection control. This includes accident and injury prevention, emergency response plan, incident reports, standard and transmission-based precautions, as well as restraints. So again, regardless of the number of questions you receive on the exam, 12% will come from safety and infection control. The next area is health promotion and maintenance, and it is both the category and a subcategory. 9% of your questions come from this area. Now, this is one of the smallest areas on the exam. Topics include aging process, and this is growth and development through the lifespan, intra, and postpartum, newborn care, health and wellness. So all of your health and wellness issues would be in health promotion and maintenance. Health promotion and disease prevention, as well as physical assessment. But do keep in mind, this is a small area of the test plan, even though it covers a lot of content. Psychosocial integrity is also a category and subcategory, and it is 9% of the exam. It's pretty much what you would expect out of psych. Abuse and neglect, behavioral interventions, crisis intervention, grief and loss, and therapeutic communication. The next area is basic care and comfort, and it's the first subcategory under physiological integrity. Basic care and comfort is 9% of your test questions. So when you look at the questions that you will be offered from health promotion, psychosocial integrity, and basic care and comfort, these are the smallest areas in terms of weighting on the NCLEX RN examination. Topics included in this include assistive devices, elimination, mobility and immobility, non-pharmacological comfort measure interventions, and nutrition and oral hydration. The second category in physiological integrity is pharmacological and parenteral therapies, and 15% of the questions on your NCLEX RN exam will come from pharmacological and parenteral therapies. So the category that has the most number of questions is management of care at 20%. This is category number 2 at 15%. Pharmacological and parenteral therapies include adverse effects, contraindications, side effects of medications and drug interactions, blood and blood products, dosage calculation, medication administration, so the rights of medication administration, and total parenteral nutrition. The next category in physiological integrity is reduction of risk potential. It is 12% of the test questions that you will encounter on your exam. Topics in this include changes or abnormalities in vital signs, diagnostic tests and lab values, the potential for complications of diagnostic testing, treatments, and procedures, potential for complication of surgical procedures, and therapeutic procedures. The last area is physiological adaptation. 14% of the questions that you are offered on your exam will come from physiological adaptation, and it's the third biggest category. Topics in this include alterations in body systems, fluid and electrolyte imbalances, illness management, medical emergencies, and unexpected responses to therapies. Now, what do I want you to do with this information about the NCLEX test plan? First of all, what I want you to do is understand the importance of the categories. And when you take a diagnostic test, look at how you're doing in these big 3 categories: management of care, pharmacological and parenteral therapies, and physiological adaptation, because this is the areas where a large number of your questions are going to come from. Now, I don't want you to ignore these smaller categories, but what I want you to do is work from your weaknesses to your strengths, starting with the weaknesses with these big 3 categories. The other thing that I want you to think about is a lot of times students will say to us, you know what, my OB experience, for example, I only had a few days in OB and I didn't get to see any deliveries while I was there. So I feel like I'm weak in that area. Well, a candidate may feel personally weak in an area, such as OB, but you have to look at that compared to the whole test plan. Like I said, when health promotion and maintenance, it includes growth and development through the lifespan. It includes OB, it includes newborn care, wellness, physical assessment, and health promotion. I mean, there's a lot of content there, but yet only 9% of your questions are going to come from that area. So when you think about your personal weakness and you start getting a little bit nervous about it, make sure that you understand how it fits into the test plan, because maybe it's not that important to the test plan, but you sure don't want to ignore those things that are important to the test plan. Now, in addition to the test plan, where you have a fixed percentage of questions offered to you out of each area of the test plan, they also have integrated concepts. And what they mean is they test these concepts throughout the test, but it's not a fixed part of the test. So you have the nursing process, caring, communication and documentation, teaching and learning, and culture and spirituality. Now, one thing I do want to say about the fixed area of the test plan, you don't have to pass each area of the test plan. All you have to do is pass the exam. So remember that, but you will be offered a fixed number of questions from each area of the test plan. Now let's talk about the format of your exam just for a moment. You have different question types in there. You will have 4-option multiple choice questions. You will have alternate questions. And the alternate questions include multiple response or select all that apply, fill in the blank math questions, and the fill in the blank will always be math or numbers. Drag and drop questions where you have an unordered list of items on the left and you have to drag them to a right column in the correct order. and hotspot questions. In addition, you can have multimedia questions. These may include sounds, graphic options, or there may be a chart exhibit. Now know that the multimedia can be combined with the other question types. So you might have a 4-option multiple choice that has graphic options. You may have a select all that apply question that includes a chart exhibit. One of the things I want to say about the question types is you're sitting down to a pool of questions. And if you've listened to the discussion about computer adaptive testing, you know that there are below competency questions and above competency questions. One of the things that we hear from candidates all the time is, well, as long as I'm getting select all that apply, that means they're passing questions. No, the level of difficulty is not related to the format. They have select all that apply questions at all levels in the exam. So when you get a question, an alternate question, is the computer telling you anything that you're doing well or you're not doing well, or this is above competency, below competency? It's not. It's just simply saying that it needed to pick that next question for you, and it had to select based on 2 criteria: what area of the test plan to keep it in balance, and also level of difficulty. And it just happened to pick the alternate question. So if you get the alternate questions, please understand you're not being told anything, because these questions are found at all levels of the test. So what are you going to do with the test plan? When you take your diagnostic, you're going to look at how you do in those big 3 categories, and you're going to study from your weaknesses to your strength. Well, this concludes our discussion about the NCLEX RN test plan.